Students are heading back to class, and just a reminder, parents, Tennessee does require certain vaccines for children headed back to class.
Vaccination rates are at their lowest point in the past 5 years here in Tennessee. The Tennessee Department of Health published the most recent numbers from the last school year. 10
News reporter Nicole Borman spoke with experts about those numbers and their advice heading into the new year. Nicole?
John, Robin, Tennessee set a goal that 95% of all students in each county should be fully vaccinated. Most East Tennessee districts are below that healthy threshold. So green areas over here are above that 95% goal. Yellow counties are the ones that are 94.9 to 90% reaching that goal. Fentress and Hancock County are red, and they are the only ones in our coverage area that are below that 90% goal. The reports also showed that over 95% of Tennessee students overall used to be vaccinated back in 2020. Now we see that number go down all the way to 92 now. I spoke to Tennessee health officials on why that number keeps sinking and the risks if someone skips vaccination. Starting the school year strong happens before even entering the classroom. Tennessee Public Schools requires a list of vaccinations children must get before heading back in August. But kids are still getting sick.
While most parents still do choose to vaccinate their children, since about 2020, we've seen a decline in the percentage of Tennessee kindergarten students who are fully protected against preventable diseases like measles, whooping cough, polio, and hepatitis.
Parents have the option to exempt their child from being vaccinated, with religious practices being the biggest reason. Although this option is permitted, there have been drastic consequences nationwide.
Just last week, CDC reported that we've now had over 2,300 cases of measles across the country, which is the highest number that we've had in the U.S. in 35 years. And that is happening in Tennessee as well. We've had 3 cases of measles in Tennessee just in 2026 alone.
Knox County Health Department told me if your child does not receive recommended vaccinations, the consequences can range from no immediate effects to severe side effects. These illnesses can cause side effects that range from severe cough to brain swelling to hospitalization or worse.
Unfortunately, last year we did see a couple of previously healthy children who died from measles infections.
This would not only affect the child, but vulnerable adults if exposed to the disease. Health officials recommend you talk to your doctors about making sure your vaccines are up to date to prevent these events from happening before the first bell rings. Every county has a status reflecting where measles isn't still spreading. It's called a measles elimination status. The U.S. hasn't lost its status yet, but health officials are checking to see if recent outbreaks have spread long enough to change that. A meeting to determine the U.S.'s status will happen in November. John, Robin.
Nicole with the update. Thank you.